Good morning, everyone. My name is Justin Srivastava. I'm a superintendent in England, and I work on the National Police Chiefs Council's Public Health Approaches in Policing team with Deputy Chief Constable Julian Moss, who's the convener of today's session. The National Police Chiefs Council covers all four nations, that's England, Wales, Scotland and Northern Ireland, and it brings together learning and coordinates reform, improvements and provides value for money across English policing. Equally, it works with one of our other national bodies that covers England and Wales, the College of Policing, to develop national approaches. So what I'm going to do today is talk to you a little bit about our Four Nations Prevention Network, why we need it, the complexity of it, the work that we've done so far across the four nations, and most importantly, what are the gaps and what we're planning on doing to address those gaps. So it's probably important that we start with what does the National Police Chiefs Council mean by public health approaches in policing? And it's probably fair to say the work that we've been doing up to date has been quite England focused. But the other three nations also have a version of what I'm going to describe to you. And what we plan to do is, through the network, bring together and pool the learning together. And we did this recently on the Four Nations Conference that was held in February, where we got some really good learning from it. And I'm going to talk about that a little bit later on in the presentation. So just let's start off. What we tend to get, and I'm sure it's the same across the world, is feedback in forums and from our colleagues and teams saying, what do you mean by a public health approach in policing? Is it actually relevant to law enforcement? Are we doing the role of other agencies? So in 2018, the National Police Chiefs Council, the College of Policing and Public Health England attempted to answer that particular exam question. And I commend the document to you there. It's entitled, What is a Public Health Approach in Policing? And it was designed as a discussion paper, but actually what it became was more of a definition paper for some police forces, a discussion paper or starter for 10 for others. We've had an awful lot of positive feedback, and it's certainly further debate within UK policing. So what does it mean? Well, it starts with a population focus, and that starting point is the needs of the population rather than the individual. And that's perhaps a little bit different to reactive policing, where there's a strong focus on the individual. But what we're trying to do is look through a population lens to inform how we police. And a starter would be an ambition for every police officer in the UK to become trauma-informed, utilising a learning that we learned from our ACE awareness approaches, and then looking at how we mainstream that in a trauma-informed approach, so that it's seen as a mainstream agenda, not just a specialism in certain specialist areas. And we have to shift the curve, and that means the balance between universal and targeted delivery. And what we mean by that is we refer back to something called proportional universalism. And this was a phrase captured by Professor Sir Michael Marmot over a decade ago. And he described proportional universalism for policing as well as other agencies. And he said that, well, access to police services should be universal, and that's completely congruent with our policing by consent models. But we should be able to weight more to those that are disadvantaged, those that are more vulnerable, or those in most need, hence the term proportional universalism. A big part of our public health approaches work is our ability to recognise the causes of the causes. And see beyond the presenting behaviour is absolutely vital to policing. Every day our police officers are seeing drugs, alcohol, mental health and other vulnerabilities as a part of modern day policing. However, we need to look beyond that. And the cause of the causes in many ways has more synergy with the original Peelian principles of why policing became policing in the first place. Because the goal was not just catching criminals, but also preventing crime and thus earning public support. And that was one of the initial Peelian principles. So when we start to relate this back to policing, all of us in our careers have experience dealing with vulnerable people. They've always been a massive part of policing. And in many ways, at 2 o'clock in the morning, policing can be the phone call of choice. In fact, it was supported by the College of Policing in 2015 when they highlighted that the majority of policing demand isn't crime, but actually it's non-crime related issues, and an awful lot of that is vulnerability. And that, I would suggest, is probably recognisable in every country, in every part of the world. So arguably, if we're having to deploy to non-crime matters as a matter of course, then actually adopting a public health approach makes sense. So it's not a nice to have, but it's actually more of an operational necessity. Social mobility in the UK is limited. And therefore, what we don't want is for population-level data to become self-defining, i.e. something that happens at population level means that it's definitely going to happen to an individual. So in order to do that, partnerships between police and public health become a natural one and an important one. Police are often action-orientated and have strong community links. Our public health colleagues have strong analytical and data structures with evidence bases, and they can define their activity through those evidence bases. And often they're excellent local influencers. And you bring those two areas of business together and you end up with quite a powerful team. I talked earlier on about prevention, and we know that prevention is better than the cure. However, when we start to look at prevention in the public health context, we talk a lot about a three-tiered approach: primary, secondary, and tertiary. And for policing, that means primary prevention, preventing the problem occurring in the first place. Secondary prevention is intervening earlier when the problem starts to emerge to resolve it. And the tertiary prevention is making sure an ongoing problem is well managed to avoid crisis and reduce its harmful consequences. And that's utilised across policing, from road safety to local policing across the UK. It's a model that's well used and well known. However, and arguably, a lot of our activity is at tertiary and secondary. So one of our big pieces of work around the prevention network across the UK is to look at how we move policing more into primary prevention, working really closely with our partners and recognising that resources are squeezed. So how we move from crisis into prevention, or actually adopt a two-track model. One of the key barriers in an awful lot of our public health work has always been data. Bringing health, criminal justice and social data is one of the Four Nations Prevention Network challenges, but it's also a massive opportunity. Some of it is cultural, some of it is process, some of it is people issues, and some of it is legislative. But if you asked me 10 years ago about epidemiology as a senior police officer, I would have stared back at you. Yet when we look at epidemiology now at that population level, actually it's been really useful to us. And probably one of the best examples of that has been our violence reduction units. Each one of our violence reduction units across England and Wales, 18 of them in total, have been asked to do a needs assessment. That's brought together place-based data with things like schools exclusions, crime data, social determinants, public health data, mainstream health data, and so on. By bringing that all together, you build an epidemiological picture. By doing that, you're able to deploy not just police resources, but multi-agency resources at a place-based level, but in an informed way. And one of our big pieces of work, therefore, has been focusing on data across the Four Nations and learning from each other, as well as capitalising on best practice. But this isn't all for the police to do. A partnership approach is absolutely critical, not just for place-based leadership, but also at a strategic level. So we've got to ask ourselves the question, and we do, how far do we value system leadership at a systems level and a strategic level and a local level? We need leaders who can work beyond their authority. Well, what do I mean by that? Well, that means that leaders who can work in that complex partnership landscape, collaborating with partners, and ability to influence partners beyond their own organisation. Recruitment, retention, progression of those leaders who can work in complex multi-agency environments need to be analysed more closely, and it's a massive piece of work for us to do, both within policing and the wider partnership landscape. And it was something, for those of you who haven't seen it, that was highlighted by the University of Birmingham about 10 years ago now in their 21st century public servant work. And I would advise you to have a look at that if you can, because it's useful when you're looking in a partnership landscape. Finally, learning from lived experience and listening to our communities is absolutely critical to that. We don't see it as a nice to have or a should have, but a must have, because it is the only way for us to work with our community partners to look forward to policing in a public health context. So when we start looking at language, how does it all fit together? Well, We talk about public health approaches, but then you also hear terms like ACE-aware, trauma-informed, problem-orientated policing. For some, that can be quite confusing because there's an awful lot of crossovers. But what we need to do, I think, is look for the common outcomes. And the common outcomes within that is vulnerability, early identification and intervention, protecting those that are most in need, preventing crime and doing right by our communities. That's the common outcome across all of those approaches. And most of those approaches want to address the causes of the causes, looking beyond those behaviours. Therefore, a public health approach actually provides a framework to unite agencies towards that common outcome, and it's almost like an overarching or underpinning framework. So I just want to talk a little bit about the why. Why are we doing what we're doing? Well, thanks to Public Health Wales for lending us this image, but what it looks at there is you can see the intergenerational effect in this case of domestic abuse within a family setting. And when you speak to most professionals, they want to prevent that intergenerational effect. They want to stop the increased demand, and otherwise we're not serving our communities effectively. And if you ask most of our police officers, why did you join the job in the first place? An awful lot of them will say, well, it was to make a difference. Making a difference includes stopping the intergenerational effect that you see on the picture in front of us. So actually, there's a well-being part of what we're trying to do with our public health approaches, as well as being good for our communities. It's not easy. It's complex. And what you've got there is a bit of a diagram of complexity. We haven't got a system of order, no single strategy across England, or the four nations for that matter, around public health approaches. Neither have we got a system of chaos, I'd like to think. So what we've got is a system as a whole that's complex. And it's complex because of a number of factors, from multi-agency landscapes through to differing legislation across the four nations and so on. And what we're trying to do with the network is actually bring together all that learning in order to deconflict some of the complexity. So what do I mean by that complexity? Well, first of all, you've got a complexity of geography. And you can see there that we've got four nations, but they're all very different. So if we take Wales as an example, it's got one devolved government, 4 police forces and 1 public health body. Scotland, they've got a devolved government, 1 police force and 1 public health body. And Northern Ireland has 1 police force and a public health agency. However, England on the right there is very different. It has 39 police forces and 1 public health body. So we've got some catching up to do in England around developing a national, cohesive, cross-sector strategy and approach. We're learning a lot from the devolved governments in that regard, because they've had a national steer, and that national steer has been able to give them some advantage, and very, very closely linked to 1 policing body and 1 government body being able to talk in an effective and dynamic way. But we've also got complexity within National Police Chiefs Council. So National Police Chiefs Council does cover all 4 nations. But what you can see there is numerous chief officers with numerous portfolios, all dealing with vulnerability and working across the 4 nations. So the question is, how does all that fit in? Well, the National Police Chiefs Council has recognised it, and what they've done now is added prevention as a core function. It's going to be a new portfolio. And there's a new operating model that comes with it. So what allows us to do is bring together those portfolios and have an overarching view that can only help with our public health approach, because the majority of those approaches that you see there, local policing, well-being, crime prevention and problem solving, child protection, children and young people, violence reduction, are looking to deal with the same approach, i.e. deal with the cause of the causes with a primary, secondary and tertiary prevention lens. So actually, there's an awful lot of synergy between them, and therefore public health approaches gives us a real opportunity. There's also complexity of strategy. There's no cohesive prevention strategy across the 4 nations. And when you look at the diagram on the left there, actually, the landscape's quite confusing. So you've got an awful lot of different bodies, all working with vulnerable people, all working in the prevention landscape. No one's bringing them together. And that often applies as well at a government level. our Home Office, health colleagues, Department of Education and so on, aren't necessarily talking in the same way that we'd like them to because of the complexity of their strategy and strategic development. Yet when you speak to our local place-based leaders, they say to us, hang on, we want clarity from at a national level. We need it. So there's a real need for our prevention network to start helping to assist the government and the government departments with providing that clarity, as well as assisting those national bodies that you see there with providing some clarity. We've also got complexity of the partnership landscape. And I've just put on the slide there a few of the organisations that are working at a national level. It'd be remiss of me not to mention the 2018 National Police and Health Consensus, which is part and parcel of some of those organisations there, and sought to bring them together around dealing with vulnerability, early intervention and prevention. But behind those organisations, you see, is a myriad of other ones. And at the moment, one of our roles is to try and map that out, both for England and for the 4 nations. And we've started on it, and it's proving to be quite a task, as you can imagine. So what have we done so far? Well, I've touched on some of the work that we've done, but I just want to go into it in a little bit more detail. So I mentioned earlier on the Public Health Approaches in Policing discussion paper. That created a start for the discussion and has been useful across the system. But we've also worked very closely with the College of Policing and Chief Superintendent Paul Bartolomeo around developing a set of public health approach to policing principles. And these principles set out a core principle delivery for what we are asking the police service in England and Wales to do around public health approaches. But it's equally applicable across the 4 nations, and we commend it to the other nations and anybody else that wants to use those principles. The consensus statement there, it was a focus for police, health and social care and the voluntary sector and community sector to improve health and well-being, prevent crime and protect the most vulnerable. It was written at a national level and signed off by a national level, but it was always designed for delivery at a place-based level. It was always designed for system leaders at a local level to be able to take to their colleagues and their other system leaders and say, look, this is what's been agreed nationally. How can we translate this for our local area? And that has led to a consensus task force. And the Consensus Task Force is very active. It's led by Public Health England, has representatives from a number of agencies that you see on there, and it's led by Linda Hindle, Sandra James and Helen Christmas. And we're looking at embedding the consensus into the work of Public Health England as it goes forward into its new body over the coming years. We've also got other work ongoing. We've talked a little bit about the 4 Nations Network. The violence reduction units have been a massive opportunity for our public health approaches. Most of the 18 violence reduction units have been underpinned by public health approaches. They're doing academically evaluated work that has allowed us to have an evidence base around primary, secondary and tertiary prevention. And that has allowed us to start to take our learning forward in a 4 Nations way. And that in turn led to our recent 4 Nations Public Health Approaches and Policing Conference that was held in February. We originally designed it as a 2-day conference. We had so much interest that we expanded it to 5 days. We had 65 speakers. We expected 400 to 500 delegates and had nearly 1,700. We had world-class inputs from across the 4 nations and beyond. And what we saw was lots and lots and lots of new networks developed, but perhaps most importantly, enhancing the debate around public health approaches. So we now have plans for webinars and future conferences in the going forward, and our colleagues at Revolving Doors are academically evaluating the conference for us as well. Later on today, you're going to hear from my colleague and friend, Superintendent Jackie Hawley, around the development of the England Police Network. So I'll hold on that for now. So what are the gaps? Well, there's an awful lot of investment that's needed for system leaders to work through this complexity that I described earlier on. There's some great examples, but it's not consistent. So we need to look at change in a different way. And arguably, the public sectors often take a systematic approach to change. Gantt charts, spreadsheets, and so on, milestones, benchmarks, and so on. But we're working in an incredibly complex environment where no one person is in charge, particularly when you're looking at multi-agency change. So perhaps we can lead by the principles of viral change. And you can see there the work of Leandro Herrero around viral change. And this is about changing behaviours and influencing behaviours. And this would help us greatly, I think, in the field of both primary prevention, secondary and tertiary. So we've got to ask ourselves, when we've been designing our policing models, have we actually taken a process-based model? Have we actually over-focused on demand rather than need, vulnerability? And therefore, how much does policing actually see itself as the wider structure within the wider partnership structure? And can we actually shift our models at the same time from reactive and crisis-led through to actually dealing with our preventative approaches at the same time while still managing our demand? I think that's where our prevention network has an opportunity and a risk, in as much as we can help assist that debate, but what we've got to do is influence those system leaders accordingly, both within policing and the wider sector. You've got an awful lot of work that's ongoing across the devolved nations around ACEs and trauma-informed practice, and a lot of really good branding that you can see there on the slide around the ACEs work. Less so within England. I think we're a little bit behind. And my colleague and friend, DCC Julian Moss, is doing an awful lot of work to try and challenge Whitehall about that. Why hasn't England got a clarity of strategy or a single strategy? Why haven't we got a single brand around trauma-informed practice, ACEs, and cross-sectional policy, process and strategy that goes with that, and therefore helps our local place-based leaders? And there's an awful lot of work that's ongoing within both the Home Office and other government departments and then PCC to try and address that debate. But we're at the beginning of that piece of work. And this plays into local structures, because obviously within local structures, we've also got an awful lot of partnership work and an awful lot of different relationships, different boards. You can see there some of the examples: wellbeing boards, safeguarding arrangements, and so on and so forth. But all of them need some clarity around primary, secondary, and tertiary prevention, particularly when we know that primary legislation is coming to help our community safety partnerships around serious violence. So there's an argument there that that will be a vehicle for us going forward. So in order to help us, we know that there's some really, really good work ongoing across all four nations. So working closely with the College of Policing, we've actually had quite a big call for practice. The majority of policing across four nations have answered that call for practice, and we're now looking to build together an evidence base around primary, secondary, tertiary prevention, ACEs, and trauma-informed practice, as well as public health approaches. That's going to be really useful for us going forward, to be able to give our partners and our agencies examples of where it's worked, and therefore how we can upstream and mainstream it. So finally, thanks for listening to us today. I put some contact details down there. By all means, feel free to get in touch and enjoy the rest of the day. Thank you.